Everyone. So I am Dr. Tahsin Raquib Abonti. I'm working as an assistant professor in the Department of Orthodontics in Pioneer Dental College and Hospital. Firstly, I would like to thank this organization, IMFSA Bangladesh. So this is they are working with a collaboration of BIMSSCON. So this is a very great platform to create social awareness and healthcare awareness in this pandemic. So I feel really honored and obliged to be invited in this platform and share my point of view in this platform and representing here as a dentist in this association. So, so my sincere gratitude to all the members who are organizing this. So today I would like to talk about healthcare from the dentistry point of view and some do's and don'ts. So what as a practitioner, what we should do and what precautions we should take, and also from the point of view of a patient. So now I would like to start my presentation. Okay. So today my topic of presentation is dental care in COVID-19 pandemic. So as you all know that so dental care is a concern in general aspect, but till now the dental awareness is not so much there in general health care, I must say. So I feel very much privileged to share this point of view, not only with the dental students, also the medical students as a whole. So, so what are the general tips and what are the general techniques of oral and dental care? I would like to share that point of view with all of you today. So firstly, I would start about the current situation that we are dealing with right now, that is COVID-19 pandemic. And we are dealing with a lot of protocols, and we are in the midst of a social pandemic problem, and that is affecting a lot of systemic health and oral health also. So I would focus on oral health especially today. So during the COVID-19 pandemic, effective prevention of oral problems and self-care remain a high priority. So why we are focusing on the self-care? Because as we know, during the COVID-19, exposure is a question. Like we are not able to socialize. We are not able to go out of the house so much. We are not able to take the medical help that we require because of this pandemic. So what we can do as individual is that we can take self-care as the high priority. Then I would like to discuss something like how it transmits, the transmission of the COVID-19 virus. So it can occur through direct, indirect, or close contact with infected people through infected secretions such as saliva and respiratory secretions, or through their respiratory droplets. So as you all know, when we are taking care of the oral and dental health, so we have to, we are very vulnerable to getting the infection when we are treating a patient and when the patient is coming to us. So we are in a very susceptible position to provide any sort of health care, because that is the most susceptible area we can work on. So we need to have some guidelines for that. So it is advisable for both dental practitioners and patients to follow certain guidelines to prevent this disease. Though it is recommended that we should not go out for dental care if it is not required. So we need to follow certain guidelines. So as I said earlier, that self-care in this context is very important. So in this context, so first we have to learn the basic brushing technique for your teeth, because if we can brush our teeth properly and make sure it is clean and our oral environment is free of all the germs, then we can protect our oral health from some sort of severe sort of disease, or we can avoid going to a dentist in this pandemic. So proper brushing technique is the basis of dental care. So first we have to think about, like before beginning, we have to keep some things in our mind that before beginning. So what are the things we need for proper brushing? So first we need a good toothbrush. So there are like different types of toothbrush with soft bristle, medium, and hard. So we have to choose according to our need. And especially for extra precaution, the toothpaste that we are using, so we can choose a fluoride containing toothpaste for brushing, for protecting our teeth. And we also need to take care of the brush that we are using, that we have to replace it every 2 to 3 months. And in some cases, we have to replace it even before that time. Okay? And next thing I would like to mention, that we have to brush properly all the surfaces, giving ourselves at least 2 minutes of time to brush all the segments, like upper right side and left side, lower right side and left side, dividing the whole mouth into 4 quadrants. And the timing is also important. I would like to emphasize on the fact that minimum 2 times brushing we recommend. One is after breakfast and one is at night before bedtime. So these are the things we have to keep in mind before brushing properly. So next we are coming to how to brush properly. So, because there are many patients we get in our practice, like they brush even 3 times or more, but we see the oral cavity is not clean enough, because the technique is in the front side and also in the back side we have to clean it, and we do not brush the teeth together, like upper teeth and lower teeth. So we have to clean it separately, the upper teeth separately and the lower teeth separately at 45-degree angle. Next, we go to the back side of the cavity, oral cavity, and then we hold the brush along the chewing surface, like the back side, and brush it properly on that side. And then here, the occlusal surface, we call this occlusal surface. We have to clean this area very carefully in a circulatory motion so that all the surfaces are clean. And then when we are done with cleaning all the tooth surfaces, then we have to be sure to brush gently along the gum line, because we know there are something called plaque or dental stones. They develop along the gum lines. So we have to clean that area also properly. And at last, we have to brush our tongue in back to front sweeping motion to remove food particles and help remove all causing bacteria to freshen your breath. So all these things we will do we will take time around brush all the surfaces of the teeth. Next is the important thing is proper floss. Brushing, more or less people do it, but flossing, people are not well aware of it, that this is very important technique along with brushing, because however carefully we do the brushing, still we have some things like if you are seeing this picture, this interproximal area of the two teeth, we cannot clean this area properly with only brushing. So we have to use dental floss to clean this area. Otherwise, your teeth is not clean more than 60% if you are not flossing. So that is very important. So again, here we can, there is a demonstration of how to use the flossing. And before beginning, I would say, like, before brushing, if you floss it properly, all the teeth, and then brush, then you are cleaning up the whole cavity in a proper way. So how we can do it? You can use about 8 inches of floss, and then we have to take it in our 2 hands with rolling around our fingers, and we have to make a curve like a C shape and slide it inside the tooth surface as shown in this picture. Then it goes inside, and then you again bring it outside. So that is how you clean the interproximal areas of the teeth. So this is how the front teeth and also the back teeth, we clean all the interproximal areas, the area between the two teeth. Okay, so this is how we can floss. So it doesn't take much time, but it is very important for cleaning up the whole oral cavity. So once we are done with flossing and then proper brushing, then we have to rinse our mouth thoroughly to clean all the residual food particles or anything, so it will wash out from the oral cavity. So this is how we can take care of our teeth and gums properly. Next is, like, I will show some things like if we do not take care of our teeth properly, then what happens? And also, along with brushing technique, we have to take care of the food intake, what type of food we are eating. So that also plays a big role in maintaining the health of maintaining the oral health. So first, I would like to demonstrate, like, this is a picture of a healthy tooth, and this is the gum here. So usually in our cavity, this is a dental biofilm or plaque we call. This is a soft type of a layer. It forms every 12 hours. Like, if we are not cleaning our tooth within 12 hours, it forms a soft dental biofilm or plaque. So when we do not clean it properly, so this forms, and the sugars in our drinks and foods that we take, along with the bacteria from the plaque, it creates acids in our oral cavity. And the normal pH of our oral cavity is around 6.4. So it's like a neutral pH. So then when the bacteria starts acting, the pH drops. And then it starts demineralization of the enamel. Enamel is the outer layer of the tooth surface. So demineralization means that the minerals that are present in the enamel, that is calcium and phosphate, they gets out of the enamel surface, and then the surface becomes weak, and then it eventually it turns into caries or cavity, which we see in a tooth surface. And this is the first step of forming caries or cavity. So here you can see like how it is important to properly clean your tooth every 12 hours, and also the food we are taking. So for maintaining oral health, so it is better not to take too much starchy food or carbonated drinks or sugary food. So that causes the bacteria to make this type of caries and cavity. So next is like there are a few other things, like in the first step when the caries is developing, if we keep it untreated, because unfortunately when the caries starts in the beginning, there is no pain. So, so the patients usually do not recognize that they are having any trouble. And unfortunately, in our country, still, we do not have something like a 6-month regular dental checkup. So the patients do not come unless they are not suffering. So I need to create that awareness also, like everybody should get a dental checkup every 6 months to see if they are having a little bit of problem, that we can fix it earlier, so we do not they do not complicate to make it more bigger problem. So for example, like in the beginning there is a small cavity or caries developing, as you can see here, and if it is untreated or unnoticed, then it gradually gets inside the tooth. And first it is in the enamel surface, then it gets into cementum, then it gets into dentin, and then the last thing is pulp. So this is the nerve, where the nerve of the tooth is, we call it pulp. So when it affects the pulp, then the patient starts feeling pain. And usually the patient comes at that time where we have to do more complicated process to reverse the pain. So then when it affects the pulp, we are calling it pulpitis. And still, if the patient ignores and do not take any treatment, then the infection goes all the way down towards the root, and it causes abscess and periodontitis and other sort of complicated infections. So we are also seeing similar type of situations here. So dental caries and inflammation and infected pulp causing abscess. So sometimes we have different types of options to give treatment, but we would rather prevent all these things by taking good care of the oral health, by doing brushing and flossing properly and taking care of our diet, so that this type of situation we can avoid, especially in this pandemic. So I will emphasize again on brushing and flossing properly. So now I will talk about the guidelines. So World Health Organization has given us guidelines like in an oral health care setting, what should be the setup and which problems we should treat in a dental practice or which we can avoid. First, this is for the dentists and the dental students, especially for understanding like what things we should handle in a oral healthcare setup. So as it is written here, WHO advises routine non-essential healthcare must be avoided during COVID-19 pandemic. Like for example, the 6 months oral health checkups, dental cleanings like scaling and polishing, preventive care like doing filling, and aesthetic dental treatments where we need to fix a fractured tooth, or there is a gap of a tooth where we want to improve aesthetic considerations. We must avoid it during this pandemic because those are not life-threatening or the patient is not suffering severely with pain or anything. So we have to avoid it. So again, I will tell, so as we are avoiding this type of treatments now, so patients should do the self-care properly. And urgent and emergency oral health care must be provided. That includes acute oral infections, swelling, systemic infection, prolonged bleeding, severe pain, not controllable with analgesics. So any sort of pain and bleeding and swelling, so we have to give treatment to those patients. So because the patient is suffering and it cannot be treated by themselves. So we have to understand first what are the transmission and risk factors in dental practice. So how the transmission occurs. So the COVID-19 is thought to spread primarily between people who are in close contact with one another within 6 feet through respiratory droplets produced when an infected person coughs, sneezes, or talks. So airborne transmission from person to person over long distance is unlikely. However, COVID-19 is a new disease and we are still learning about it. So as we know, like every day, the rules are changing, the guidelines are changing. So it is very much unpredictable how to go about it. The virus has been shown to persist in aerosols for hours and on some surfaces for days under laboratory conditions. So this SARS-CoV-2 can be spread by people who are not showing symptoms also. So this is a very difficult situation that we have to understand that everybody is at risk. So everybody can be a carrier. So we have to have all the precautions that we can take. And the risk in dental practice involves the use of rotary dental and surgical instruments such as handpieces or ultrasonic scalers and air-water syringes, which are producing droplets. And these instruments create a visible spray that can contain particle droplets of water, saliva, blood, microorganisms, and debris. Surgical masks protect mucous membrane of the mouth and nose from droplet spatter, but they do not provide complete protection against inhalation of infectious agents. So it is whatever precaution we might take, we are still not sure of the risks, how we can protect ourselves and our patient from these things. So we have to be very careful in this situation. So next is containment of the spread of SARS-CoV-2 in oral health settings. So if we need to treat patients, we have to go through a multiple of protocols. So the first thing is screening and triaging of patients. So first, in case of screening, we have to give importance to screen patients before their appointments, either by virtual or remote technology or telephone. So telescreening plays a very important role in this. So first, we have to be sure of what complaint the patient has, and do the patient really need to come to the dental chamber or not. If the patient reports symptoms of COVID-19, avoid non-emergent dental care and use the phone advice line tool for possible COVID-19 patients. If possible, delay dental care until the patient has ended isolation or quarantine. So we have to maintain that protocol, particularly about the symptomatic patients. Develop, whenever possible, a remote assessment of urgent or emergency oral health care patients by oral health care personnel based on the 3 A's. Those are advice, analgesics, and antibiotics. So these 3 things we have to do if, like, we understand the patient is manageable remotely. With these 3 things, we have to first try this out before letting the patient come into the dental practice. Then request that the patient limit the number of visitors accompanying him or her to the dental appointment to only those people who are necessary. So we are absolutely restricting the attendance if it is not necessary. So, so visitors, we are not encouraging to come along with the patient. So there are some screening questionnaire what we can do for the patients. Like, there are some questions. In the past 14 days, have you or any household member traveled to areas with known cases of COVID-19? So patient needs to be very true about and honest about answering these questions. In the past 14 days, have you or any household member had any contact with a known COVID-19 patient? Have you or any household member have a history of exposure to COVID-19 biologic material? Have you had any history of fever in the last 14 days? Then have you had any symptoms such as cough, difficulty breathing, diarrhea, nausea, body ache, loss of smell, or loss of taste in the last 14 days? What we see here, like in everywhere, the general setup, people are checking the body temperature. So that is not only the indication or symptom of COVID-19. So we have to take care of that. Like, we have to ask about the other symptoms like breathing difficulty, diarrhea, and in some cases, all these are absent, and there is a loss of smell or loss of taste. So that is also a very important symptom in COVID-19. So we have to ask about all these symptoms. So an urgent dental need question, like if the patient is understanding that whether it is urgent to come to the dental practice or not, we have to also assess that. Next is assessment of a true emergency. So we have to assess it also, because sometimes the patients do not understand like whether they are really in emergency or not. So are you in pain? Then what is the level of pain? We have to get it, and the history of pain. And if there is any swelling or abscess, if due to the swelling there is a fever, or the patient has trouble swallowing, or there is difficulty in opening your mouth, or there is any history of trauma or not. So we have to check all these criteria. So after doing all these screening procedures, so then if we think the patient needs to come to the oral health care setting, then we have to take a lot of protocols and precautionary steps to save ourselves and also the patients. So first, we will begin with the staff performing triage on site should maintain physical distancing of at least 1 meter. So before starting the treatment, the patient should, the staff members, if possible, they will maintain a 1 meter distance apart. Obviously, during the treatment, the doctor and attendant, assistant, at least one assistant, they need to be there very close to the patient. Then all oral healthcare personnel should continuously wear a medical mask during their routine activities throughout the entire shift and should change their masks after caring for a patient. So for every patient, there will be a change of the mask. So that is mandatory. Prior to treatment, all oral healthcare personnel undertaking or assisting in the procedure should perform hand hygiene according to the WHO's 5 moments recommendation. Preferably using an alcohol-based 60 to 80% alcohol hand rub. So WHO gives us some guidelines of like how to clean our hand. So I will recommend before using the alcohol-based hand rub, if it is possible, it's better to use soap and water to clean the hand. Then on arrival to the oral healthcare facility and until the moment of oral healthcare, patients are encouraged to use medical or non-medical masks. Space scheduled appointments to reduce the number of patients in the waiting room so that the patient can maintain physical distancing of at least 1 meter. So that is why we are saying we are discouraging to bring any attendant. So lesser the people, it is more easier to maintain this type of distancing. Patients should be unaccompanied unless they require assistance. Adequate ventilation in the oral healthcare settings should be provided. In closed room, installation of HEPA filters are recommended. Ask the patient to rinse mouth with 1% hydrogen peroxide or 0.2% povidone iodine for 20 seconds before starting the treatment. Oral health care involving aerosol generating procedures should be avoided or minimized, and minimally invasive procedures using hand instruments should be prioritized. So we know the aerosol generating procedures we have to avoid because these are forming those droplet and they are contributing to droplet transmission. So it's better if we can avoid it. Ensure that oral healthcare personnel are trained to use appropriate personal protective equipment and also a surgical mask, eye protection goggles, or a face shield that cover the front and sides of the face, and gloves. So we have to be absolutely taking all the precautions before giving treatment. So there is a demonstration of like CDC recommended like how to put on a surgical gown and mask and goggles, gloves, face shield before starting the treatment and how to remove it. So we have to all this, we have to take all these protocols step by step. We should not skip any of the steps. And at last we have to wash our hands or use an alcohol-based hand sanitizer immediately after removing all PPE. So now we have come to the end. So the COVID-19 global pandemic continues to have devastating health, economic, and social effects, and is profoundly affecting the delivery of health services. It has brought multiple challenges in health sector in a densely populated country like Bangladesh, mostly due to its unpredictable trajectory and delay in integrating public health activities within the health delivery system. although the dentists from Bangladesh have shown good knowledge, awareness, and practice regarding COVID-19. So in the end, I will say that prevention is better than cure. So I will request everybody to take care of their oral health by taking care, by doing brushing and flossing properly so that they can prevent the disease. So thank you very much for joining with me in this. So I hope, so this presentation will create some awareness. Thank you all.